going to talk about the FullBucket veterinary anti-diarrhea drench. This is a very novel product in the way that it combines several well-documented, effective products that address the needs of horses with intestinal issues. This fits very nicely in our line of intestinal supplements that FullBucket has, and this is perhaps our finest hour, our finest product that we've designed in its clinical capabilities and meeting some clinical needs that equine practitioners have. So the product composition of the anti-diarrhea drench is that we've got a bioadsorbent clay, which constitutes approximately 500 grams of our 1 kilo product. So about half the product is made up of this bioadsorbent clay. So that's a pound of a clay. This clay is well known throughout history. It's been used in ancient times. It's been used by Native Americans. It's been used in modern science. It's documented not only scientifically but also through clinical use for eons to work with intestinal ailments. How does this work? The bioadsorbent part of this is that the adsorbent is an object that will actually carry something else off. It doesn't really change form or change shape with it's kind of like a piece of charcoal that you have in the water filter. It's gonna take up the lead or the impurities in the water, but it's not going to make that charcoal swell or change shape. But there's just so much surface area on that charcoal that it can do that. Now the clay works exactly in the same way, and so the adsorbent clay will actually has areas that can take on things like bacterial toxins, endotoxins, also external toxins that a horse may consume where it's not meant to, so a rat poison or some sort of pesticide or something that the horse came in contact with. So an adsorbent is going to carry those things out without really changing form. So you don't have to worry about giving a clay and having this stuff act like a sponge and expanding and perhaps even blocking the passage of normal gastrointestinal contents or binding up the horse. This type of clay doesn't do that. It actually just goes in, carries things out, and then transports them out of the intestinal tract. Part 2 of our anti-diarrheal drench is something really neat. These are egg-derived antibodies. And antibodies are immunoglobulins. They are things that are produced by the immune system that have gone in to target a pathogen or a disease-causing microbe. And they go in there and they bind to that and they carry it away. Or they bind to it and go to the body and say, hey, look what I found, body. There's some salmonella here, and you need to sound the alarms and tell everyone that there's salmonella trying to invade us and to send the reinforcements. So that's what an antibody does. It not only has the ability to carry off or to destroy a pathogen, but it also will mark a pathogen so that whenever it comes across any of the intestinal immune cells that are lining the intestinal tract, which the intestinal immunity is our largest part of our immune system in all actuality. So it'll take it in there and it'll say, hey, Clostridium difficile just arrived, sound off the alarms. So antibodies are very, very important. And these are antibodies that are derived by taking an egg and immunizing it against Salmonella, Clostridium rotavirus, Clostridium difficile, and Clostridium perfringens. And also E. coli. And so these things are primed up, these eggs are primed up, and they're just churning out these antibodies. And these antibodies are collected, they're processed in a lab, and then they are packaged in here in a dry form, and they're combined in a very large amount with this bioabsorbent clay. And so not only do we have the native properties of a clay that's going to carry bad things off, but we also have some egg-derived antibodies that are going to go in there and target pathogens and also alert the immune system to their presence. So this is great technology and something that hasn't been utilized in the equine adult at all. So the third product that we have in our anti-diarrheal drench is going to be the S. boulardii. S. boulardii is a yeast probiotic that has been the cornerstone of several of our other GI products. S. boulardii is probably the most well-studied yeast probiotic in the world, and is hands down the most effective way of supplementing a horse with a probiotic. So a lot of times we've gone in to treat horses with diarrhea. We wanted to drench them, and we've tubed them with various things, but everything we're tubing them with is basically got some inert property. So it's got a property that you put in there, and it has, it either stops something or carries something out, but it doesn't actually have a physiologic property. Now we're starting to add something live to the whole milieu of what's going on in the intestinal tract, and this S. boulardii yeast in very high concentrations. We put it in at 100 billion. So we put it in 100 billion in a dose, and so that's going to provide a high concentration of probiotics. These are lyophilized yeast, and so they're kind of in a freeze-dried state, and they're activated once you add water. So these have a good shelf life. They don't have to be carried in a refrigerator or anything like that. They're actually very stable at room temperature. So we've got a probiotic, we've got antibodies, and we've got a bioadsorbent clay. Now, we also have added electrolytes. We all know that horses with diarrhea have tremendous fluid losses and tremendous electrolyte losses. In fact, part of the biggest battle may be to combat these fluid and electrolyte losses. So as we used to make up these homebrew batches where we would add some of this and add some of this and grab a scoop of electrolytes and put that in there, now we've got a product that is all in one in a 1 kilo container. You mix with 6 liters of water. It mixes easy. You pass the stomach tube, and you've got electrolytes in there. So you've added water and electrolytes to help with that rehydration process. So a very, very key component. We use chelated calcium and magnesium for optimal absorption, as well as us using potassium chloride and sodium in our electrolyte composition. So the fifth part of our anti-diarrheal drench is a prebiotic. The prebiotic is called a mannose oligosaccharide, which is typically derived from the cell wall of a yeast. Now this is a dead yeast, so it's not a live product, but this is just a cell wall product. And what the cell wall or prebiotic has the capabilities of doing, which this is prepared at an extremely high dose to be added to this whole thing. So this is not a trace amount. A lot of times you'll see someone add 200 milligrams to a gram, maybe 2 grams of prebiotic. This is an SOS formula. This is an emergency formula. So everything we put in here is at optimal concentrations you won't find in any other product. So the concentration of prebiotic is very substantial. So these prebiotics go in, and again, they signal the immune system in the intestinal lining, hey, go ahead, prime up, we've got problems in here. And then they also have the ability to act as a decoy with other pathogens. So a pathogen may come up, see this prebiotic, and actually bind to it, thereby actively being transported out of the intestinal tract. So they do have the capabilities of working on there. So you've got a prebiotic and then you've got a probiotic, of course, with Saccharomyces boulardii, which is alive and it has the ability to neutralize Clostridium difficile toxins, has the ability to transport salmonella out of the intestinal tract, so as well as stimulating the immune system and regulating intestinal secretions of water. So the probiotic has got lots of very physiologic activities, and then you have the prebiotic, and it does as well. And it's not a passive inert ingredient. This has well substantiated, documented effects of what it does to the pathogens, to the healthy microorganisms, and also to the immune system in the intestinal tract. And then, last but not least, is gut fuel, and gut fuel is what we call L-glutamine. And L-glutamine is simply an amino acid, but the bottom line is that every enterocyte or every cell that lines the intestinal tract has to live on this particular amino acid. And the body can provide this amino acid whenever it's all healthy and everything's going fine. The body makes sure that there's plenty of this amino acid that's created just for these cells. But whenever you get a gastrointestinal problem, then this becomes an essential amino acid, and it must be supplemented. Otherwise, you have an enterocyte death, and that just adds insult to injury. So we add a healthy dose of L-glutamine to the entire product. So we're going to not only try to remove pathogens, not only try to resupply electrolytes and water, but we're also going to be feeding the actual cells that line the digestive tract. So with these 6 active ingredients, there's nothing like it. You can find products that have a bioadsorbent clay in them. You can find products that have just egg-derived antibodies. You can find products that have just probiotic. You can, of course, find plenty of products that have electrolytes in them. And you can find some prebiotics that are combined with probiotics, and you can find, occasionally you can find some L-glutamine thrown in with some other things. But nowhere do you get a complete product that is combined in one thing that is designed by veterinarians for veterinarians to treat gastrointestinal issues. So that leads us to who needs this veterinary anti-diarrheal drench. And that is not a real complicated story, because as veterinarians we deal with this all the time. We don't care to deal with it, but the bottom line is that we see these cases and they can turn into a nightmare very quickly. So the most obvious case that you're going to see is the acute colitis. This is a horse that is presented with pipe stream diarrhea, 104 temperature, brick red mucous membrane, suffering from all the effects of endotoxemia, dehydration, septic shock, and this horse is in trouble. Of course, that varies in scale from 1 to 10 on how bad these things are, but we've all seen them, and we all know that part of what we're going to do is tube the horse with something to try to get rid of some of those endotoxins, and we're going to try to rehydrate the horse enterally, resupply some electrolytes, and we're going to try to do whatever we can to repopulate that intestinal tract with something healthy and try to feed those intestinal cells. So this is a perfect situation where you would grab a kilo of this product, mix it with 6 liters of water, pass an nasogastric tube, and administer the FullBucket veterinary anti-diarrheal drench. Now, that's obvious. Sometimes less obvious is the what oftentimes is called the impending colitis. And this horse is the horse that quit eating, that's it's got a fever, perhaps. It's showing some signs of endotoxemia with the elevated heart rate, injected mucous membranes, depression, dehydration. but you can't find out where. You're looking at the horse and it doesn't have a cough, it doesn't have swollen lymph nodes, it doesn't have any other signs of infection. And perhaps you perform an abdominal ultrasound and you see swirling intestinal contents in the cecum or in the large colon. And you get the idea and you do some blood work and the white count is crashed out on this horse. And so you're dealing with leukopenia or depressed white blood cell count. You get the idea that there's something bad getting ready to happen on this horse. And so we see a lot of these horses and you typically want to tube them. Again, try to remove whatever pathogens you can, try to repopulate with healthy microorganisms, try to provide some rehydration solution, and also try to feed those enterocytes. So tubing these horses with this product is a great idea. Another very common situation, especially in referral hospitals, is dealing with the post-operative horse. And sometimes this is a post-operative horse. It's an orthopedic case that has been on potent antibiotics, and all of a sudden you see a fever, or you start to see a little bit of loose manure, or you start to see a depressed white count, or something tips you off that, hey, through the stress of surgery, through the use of antibiotics, we're dealing potentially with a stress or antibiotic related diarrhea, and I need to be proactive in this case. So this would be a good time to think about going ahead and tubing the horse, getting a high load of probiotic in there, going ahead and getting the stuff that's going to carry some stuff out with you, and so that's a good time. Now, more obvious is the post-operative large colon colic surgery. So the colon torsion, the displacement, the large colon impaction, the small colon impaction, those hindgut issues that you operate on, typically you're not going to be tubing something post-op on a small intestinal surgical case, but hindgut, so large colon, cecum, small colon, those are going to be obvious. The next day, as soon as the horse is back on his feet, we like to tube the horses with the product. And we like to make sure that we get high concentrations of good probiotics in there. And we're trying to carry out any residual pathogens and trying, if we've got something that wants to kick in, Clostridium difficile or something related to the antibiotics, that we've got something on board to prevent that. Then we're going to follow up and keep these horses on some paste. And really that goes for most of these situations where we have the anti-diarrheal drench given, then 12 hours later, I'm going to come back and I'm going to give them a high dose of the probiotic paste. Now, when to repeat? I repeat as long as I have a problem. So if I still have watery diarrhea 24 hours later, I'm going to tube the horse again. Okay? If I've got a situation where I think I have an appendiculitis and the horse just is still sitting there on go the next day, I'll tube again. Or if he's gone ahead and broke with a little bit of diarrhea, I'll tube again. In the post-op horse, we'll typically tube once and then sit back and watch. And really any of these situations that don't manifest or that the product helps them go ahead and stop having this condition, inflammation of the intestinal tract, colitis, then we're going to just step back and we're just going to keep them on a probiotic paste and try to load them up with high numbers of Saccharomyces boulardii and prebiotic. So it's not confusing when to do this. The whole idea is those times where you wanted to reach for something, the horse has got a hindgut problem, now you can reach for one product and it provides 6 very tactfully composed active ingredients, and we can put those into the horse and hopefully make a big difference in the outcome.